All right, ladies and gentlemen, my name is Jeremiah Robert, and you are welcome to Clinic Online Plus pre-launch. I am your host for tonight. Clinic Online Plus is a platform where the patient connects with the doctors and the doctors connect with the patient, where it provides a premium healthcare system to the users, right? And today it is our pre-launch, and this initiative is being brought up by Dr. Babatunde Emmanuel. He will be doing his introduction and more the vision, the mission, and insights about the Clinic Online Plus.
All right. Thank you so much for that introduction. And permit me to say, welcome, everyone. Thank you so much for joining us. I've been reading your comments. That's why you see me looking at my screen. Thank you so much for joining us. We really, really appreciate your presence. And this launch is actually because of you. That's why we're making this. We decided to put this together because we don't just want to tell you, oh, we have something ready for you without introducing it properly to you. So this is us introducing what we have been working on over the years. Team, are you ready, please? Is my presentation ready? Because I would like them to see some of the things that I'll be sharing with them. Beautiful, beautiful. Thank you so much. Yeah, so as you all know, or probably for those who don't, the project that we are building or that we've been building, that we've been working on over the years, is Clinic Online Plus. When you look at the name and what we are introducing to you, firstly, you might have a couple of questions to ask us, right? You called it Clinic Online Plus, so why is it that the first solution you're providing it's just a platform to connect doctors? Don't worry, it's when you want to build a house, you don't start with the doors, the lintel, and the roof. Is that correct? First, you want to lay a foundation because you know that if you have a solid foundation, definitely the building can stand properly on it. And remember that there are different types of building, the same way there are different types of foundation. Am I correct? So let's go or let's run into it. Today, we're looking at the African silent crisis. Yeah, because there is a problem that is ravaging around Africa, especially the health sector, and a lot of people have been silent about it. And when you look at it, when you turn to your left, you turn to your right, telehealth is everywhere, meaning that we are not the first person introducing comfort to medicine. We are not the first. We are just changing the narrative. We're just turning the switch a little bit because we took our time to study and confirm what exactly is the problem and what exactly are many companies or many health tech ignoring. And that is the first problem that we are trying to solve. So I titled my presentation The African Silent Crisis. And why we decided to do that is because there is a crisis, all right, but the crisis is silent. I'm sure you will agree with me by the time we look at the second slide, which talked about, please, can we go to the second slide? Show me. Perfect. Thank you. That's the problem. So, what is this crisis we're talking about? Number one is the fact that there is the workforce shortage that we cannot deny, meaning that today, tomorrow, next tomorrow, we're still going to continue to have exodus of doctors leaving the continent, searching for better life, searching for better pay, searching for better health services elsewhere, searching. So the exodus of this, the exodus is going to be continuous. Right. And then when you look at the second problem we are facing, most of the patients that we see pay out of pocket, which means that 90 to 80, about 60 to 90% of the patients in Africa do not have insurance, except for government workers, right? Who have the NHIS, that's for Nigeria, or they have the HMO with which they are augmenting their health pay. But look at the common man who doesn't have any of these. What he has to rely on is out of the pocket pay. And this is another problem that we saw. And the third thing that we notice, the third problem we notice is the distance and lack of infrastructure. Right, there is a patient that wants to that stays in the village and is having chest pain. Getting to the city to see the cardiologist is like probably 21 kilometers, and that seems impossible, right? Even though the patient decides to go on the journey, the road is very bad. Not just that, after getting to the clinic, the patient realized that there is another problem, and that's the fourth problem that we're talking about, which is the specialist problem. Do you know that there are people that do not even know that a lot of specialization existed in Nigeria, but only a few get to be seen? Like, for instance, if I talk about pediatric surgeon, some people find it weird that, are you saying that apart from a pediatrician, there's also a pediatric surgeon? Yes, there is a pediatric surgeon. But this is where the problem comes in. People don't even know that some of the specialists exist. I was sharing in one of the update video. If you have been following us online with the project that we're building, if you have been a fan, if you have been following our page, that's at Clinic Online Plus on Instagram, you would have seen some of the videos I shared. One of the videos I shared was the story of a guy that came to my office and he had a fracture in one of his elbow while he was very young. And he one thing that happened was that his parents ignored it. Why? Because of what the neighbor said. Oh, the doctors are not going to do it very well. Don't worry, don't do anything about it. Go to a bone setter instead. They will do a perfect job. So the parents agreed and went to the bone setters. I mean, traditional bone setters instead of the orthopedic surgeon who are going to handle the case properly. So the boy went to the traditional bone setter, and the job they did was very bad. Why? Because the boy could not fold the arms at 23. Do you see the problem now? At 23, the boy couldn't fold it. And now what he was supposed to do when he was younger is what he's now looking for the doctor to do for him. Imagine if a platform existed that made patients to understand that, hey, if you're looking for a specialist, be it fertility physician, be it gynecologist, or maybe you have a chest pain and you don't want to just you don't want to take chances. You want to go straight and see the right specialist, which is a cardiologist. You have you now get to have a platform that is making that happen. That is magical. And those are the problems we identify. Of course, there are more than these, but for the sake of my presentation, I kept it within these four. Please, can we go to the next point? Boom. And here comes the solution. What is the solution? Clinic Online Plus, the project that we are building. See, Clinic Online Plus is that platform that has been created for you to come to. See, when some patients don't know that this platform is actually free. Okay, meaning that when you come to the platform, you can search. You are not paying a dime to come on the platform. All we are doing for you is that we understand that it is quite challenging when you have to find a specialist. And I'll give you an example. There was a time one of my colleague needed an ophthalmology, that's eye doctor for his dad, for our dad. We searched for days. I'm talking days, almost about 6 weeks before we concluded and said, okay, let's go with this doctor. And the clinic we decided to go with didn't even have any review online. We just saw it. She told her sister to confirm the location of the clinic, and then they went to see the doctor. Sadly, when they saw the doctor, they didn't get the best from the doctor. But when that happened, I realized that no, we've got to find a solution. We've got to find answer to this very problem that these people are facing. And that was why Clinic Online Plus was created. So just think of it as your Google search, right? Google search for healthcare. Meaning, for instance, you want to see a nephrologist, right? Maybe you saw some symptoms, you're not clear about it, your urine is foaming, or you notice that you're urinating too often, and you've done your sugar tests, everything is fine, and you are worried, okay, so what is wrong with my kidney? Why is it producing too much of urine? All you've got to do is just go to Clinic Online Plus, the platform we've created for you, put in your symptoms, and then boom, it's it synchronizes your symptoms with the right physician that you need to see. And that's why we provided Clinical Life Plus. Okay. And what is the vision behind what is our vision? That's the vision of the project. Our vision is very simple, and that's to become Africa's most trusted healthcare discovery and referral platform, connecting every patient to the right healthcare professional at the right time. The vision is to ensure that no patient is allowed to suffer looking for a specialist again. That's why we are doing the work for you, which is to help you reach the specialist, meaning that the specialist you're thinking about right now, we are already working on it, trying to get that specialist on the platform. So that when you want to search for your cardiologist, you just sit down at the comfort of your home, put in the cardiologist, click on your search button. That's why we say it's just in 2 clicks, pop, pop. Okay, and then you see the specialist. Now, here is what you need to understand. We do not control the prices or the for consultation or the treatment. What we're saving you is time. Instead of you traveling or visiting several hospitals before you get to find the right one, we are saying at the comfort of your home, you can just send a message to them. Oh, this is what I have. Please, do you take care of that in your clinic? Oh no, we do not have a cardiology specialist. Oh no. So meaning that you can sit at the comfort of your home and schedule your appointment before the time so that when you have to go, you're not wasting time. Instead, you're gaining it. And that's why our mission is to help 100 million Africans, not just Nigerians, access the healthcare provider and services. That is what we are doing. We're ensuring that we get to reach 100 million Africans. For the moment, we're actually starting with Nigeria. For those that are with us, that are listening to me, yeah, for the moment, we're starting with Nigeria. Our intention is to spread across Africa. We want to actually create a unified referral platform where you can see a doctor in Nigeria, travel to South Africa, and you don't have to say the same thing over and over again to another doctor. Why? Because you have a platform like Clinic Online Plus. But we said, before we go that far, why don't we solve the first problem, which is where is my specialist? Because a lot of times people think that the specialists don't exist. Imagine when you see your medical officer or the general practitioner back at home. Now I'm talking to my African brethren, right? You're done seeing the doctor, except in some cases where the signposts of the hospital you're visiting categorically stated that, oh, this is the specialist that we have. Otherwise, you will not know, right? So that's why we are solving, we're providing the solution, saying that come, Clinic Online Plus is for you. You don't need to pay a dime. All you've got to do is just put in your symptoms and then search and you connect with the physician. Now to my doctors, to my specialists, to the hospitals, looking at our healthcare providers, diagnostic centers, the HM1 insurance. We are also for you. We are here for you as well, meaning that we are not just bringing in one-sided person. No, we're bringing everybody on board. But we decided to start with just the specialists and the hospital first. Why we decided to do that is so that we can have good control on the number of traffic, on the number of partners that we have per time. So we're testing it, checking it out. Oh, is this working? Is this moving right? Is this going well? And with time, we begin to add and add and add. That's why you need to stay tuned with us. Okay. There's going to be a Google form that will be given. If you check the comment section, I'm sure the team has provided it. You can click on it and put in your details so that you can stay connected with us. And anytime we make a new update, if there is a new doctor on board, if there's a new hospital on board, we can inform you duly. Also, if you think you've looked for your doctor and you couldn't find a doctor on Clinic Online Plus, there is a segment on the website. Don't worry, the CTO, who is also my co-founder, is going to be taking you through this. He's going to be showing you how to navigate through the website. When you see the website, you will love it. Okay, the user experience is mwah, like it's excellent. We had you in mind. We don't want you to stress at all. We don't want you to go through those options. We want to make sure that everything is properly done for you. However, remember, it's just a minimum viable product that we just have, meaning that is the shortest one, right? It's just the simplest usable formats that we just produce. So you might see some little challenge. Don't worry, just put in any comment you have under the suggestion box on the website, and we will address it. So meaning that we are not just building for you, we are building with you. If there are features on the website that you do not like or you do not understand, please feel free to send us a message on our contact details. It will also be released under the comment section for you so that you can follow up with us and follow us on our social handles. The team are also going to share that under the comments. So you can follow us just to stay updated while we take you on the journey. Now, let's talk about the one I've already mentioned, which is the next point on my slide, what we are doing and what we've done so far. So what we are doing is what I've explained, that we are creating the bridge for you to connect with your specialist, your favorite doctor, all right, easily, to connect with your favorite hospital easily. You know, sometimes I get questions like, oh, doctor, I'm attending my antenatal in a government hospital, but which private hospital will you recommend for me to go if I want to take my delivery, or peradventure, if I just want to see another doctor? You see, Clinic Online Plus has got the answer. So, meaning if you go on Clinic Online Plus now, you can have plethora of options. You have the slide coming. Don't worry. By the time the CTO come around and start showing you what we've done, because I want you to understand that where you signed up for the wait list is different. Okay, that's just should I call it part A from the B, C, D, E, F that we have in store for you, right? So we just showed you just one part of the project. The real part of the project is what you are going to be privileged to see tonight before everybody gain access tomorrow. All right. So what have we done so far? Amazingly, we've had over 20,000 visits on the website, and that's really great. That's amazing. We couldn't have done any of that without you. So if you have joined our waitlist or if you visited the website before now, here is Dr. K saying thank you so much. And one of the things I'm grateful for also is the team that I have. I tell you for a fact, they are amazing, like superly amazing. Yes, we've been around for years, test running on so many things before we decided to now say, okay, I think we are ready. And trust me, we are really ready for you. Like we are ready. So we're ready to hear your comments. You have questions, please feel free. And I'm not doing this alone. I have my prof in the house, who is a consultant, OBGYN specialist. Okay. And then we have an amazing friend of mine, right, Dr. Noble, who is also a founder for SWAC. If you don't know about it, please check him out on the on Instagram, on the internet, right? He's doing an amazing job, especially now with his focus on HIV. All right, so we have these people in our midst, and also we have Quinot, an amazing guy. Like I saw his comment, I loved it, and then I told the team to reach out to him, and since then he's been greatly supportive. So he's just one amazing. I mean, in just one year, I think he's gonna be a young and vibrant doctor doing amazing things. So we've got all of those people in the house today. So if you have any question, I'm talking to you, the listeners, maybe you're a doctor or you are a user, please answers will be provided. So do what do for now you can just take notes, write them somewhere, and the moment the CTO is done, you can ask your questions. The host will come back. That's Mr. Jeremiah to take all our questions. So that will be the end of my presentation. Okay. I really want to say thank you so much to every one of you for staying tuned with me. I hope you're able to get our message. We are here for you. Anything healthcare related, we are here for you. All right. Are we going to bring in consultation on Clinic Online Plus? Yes. That's why our name says Clinic Online. But we're telling you, aside Clinic Online, there is plus, meaning there are other several things that we are going to be doing together. Thank you so much. My name remains Case, and I would love to bring the host back on board. Mr. Jeremiah, are you there?
Thank you so much, Dr. Case, for that wonderful presentation. You've done noble according to Clinic Online's vision and mission. I really want to thank you for that presentation. And to the viewers right now, you've heard the visions and the problem we are solving in Clinic Online Plus. So key in and have better health for yourself, for your family, for your friends, and we are solving the problem of Africa's health. Ladies and gentlemen, our next to give us the platform presentation and website demonstration is no other person than the front end engineer and AI data annotator, Clinic Online Plus CTO and co-founder. He's a full stack and front end development engineer. Ladies and gentlemen, let's welcome Mr. Miracle Oladapo.
Okay, so thank you so much, Mr. Jerry, for that wonderful introduction, and thank you to Dr. Case for that vision and mission of Cliniconlineplus Plus and what we are trying to achieve with Cliniconlineplus Plus. Thank you, everyone, for joining tonight. Thank you, everyone. Thank you so much. It means a lot to us. So, my job here today is to give you a brief overview of what you'll be doing on the platform for the new platform that we're just launching, how to get on board as a specialist, and then for users, how to search a specialist, and then how to search for hospitals and clinic on the websites. So, right about now, that's what I'll be showing you now on how to do on the platform. So, first of all, to get started, when you navigate to the websites, then here we go. We have the new platform that will be coming to the general users in a couple of hours. So right now we have the landing page here where you as a user we have in mind how you'll be going about and searching for specialists on the platform. And then when we talk about specialists and doctors, we mean the healthcare practitioner you can have a conversation with. And then how do you go about that? How do you do that on this platform? You would have been thinking, well, is this not what Google is doing? Is this not what Google already has? Then where you can just search for restaurants and then you can have your restaurants in a couple of seconds when you search on Google. Then why are we like replicating the same thing? Why are we doing the same thing with Clinic Online Plus? Well, I like to tell you for a fact. When we're getting started with the launching of this platform, and then we're trying to like find specialists that we can partner with to talk with, like get on board. I'll tell you for a fact that it was one of the difficult things that we had to like deal with when we're doing our planning and analysis phase. And right about now, when you come on the platform, you can see we have like some few trending tabs where you as a general users, where you can see like the trending topics, the trending doctors, the trending fertility specialists across Lagos. And before we move on, this platform is generally like focused for Nigeria at the moment. While we have the global users in mind, we are currently focused on Nigeria for a start. So moving on, how would you go about searching on a platform like this? I would take a very simple example for a start. As a family, let's say a family that has been struggling with birth for a very long time, and then you're trying to find a specialist or a practitioner that can help you out with it. You might be finding it difficult to like just like search for maybe you don't know like the terminologies for these specialists that's like do with fertility and all. What you can do here is that when you come on the platform, you can just search for fertility here, and then when you go on search, because this is just an MVP, the minimum viable product, we don't have enough partners. So like let's just say like enough partners that has like deal with fertility at the moment. But this is the future. I mean, like the future that when you come on the platform and you're trying to look for a specialist that's like deal with fertility, you don't have to like know the medical terminologies for a fertility specialist. You just come on the platform and then search for fertility here. And then when you go for search, because we are security conscious of how you interact with the platform, we've made a very like comprehensive privacy policy and terms of service before booking or before talking to a specialist. Before you proceed with any search or any phase of the platform, you're always provided with this information, with this border box that says patient safety and provider verification notice. For your safety, we strongly recommend that consulting with verified network partners marked with our official verification badge is who you should consult with. There are partners that will be coming on the platform that they don't meet our criteria for being a verified partner on our platform. For this case, they will be placed under review or rejected. In this case, you can't book with these partners, and we strongly recommend you going through our privacy policy and terms of service before you can use the platform. Okay, so how do you have a conversation with a verified partner? How do you have a conversation with a verified partner? How do you chat with them? How do you get in touch with them? We've made a very like comprehensive and seamless process for you, the users in mind, such that when you come on the platform and then you search for a verified provider, you can either contact them through their email, their official email they've dropped on the platform, or through a WhatsApp conversation on the platform. And now you can see that we have a doctor here which is verified here, and then a doctor here which is under review. That's because this doctor that is under review has not passed the verification process of our medical board team. So when you try and like book or when you try and view the profile of this medical doctor that is under review, you can't have a conversation with them. You can't proceed to have a conversation with them either through their email or their available mobile number that they've dropped on the that they've used to register on the platform. Okay, so now for the general users trying to like get on the platform to use the platform to talk to a doctor, when you have a verified specialist, you have this verified badge mark of a verified specialist, then you can have a conversation with them. You can talk to your doctor either through direct WhatsApp if they have provided and they've enabled WhatsApp direct message for them, and then you can book via email whereby a copy of the booking will be sent to your email and practitioner email address, and then they can contact you. And then when you see a practitioner whereby their profile is under review, automatically having a direct conversation with them is disabled automatically because their profile is under review. For healthcare providers that are trying to get on board, when you come on the platform and then you're using a desktop screen, you are provided with this tab here for healthcare providers. When you click this for healthcare providers, you are directed to the page for the healthcare providers where you can sign up and come through the verification process. So when you as a partner or healthcare provider, when you come on the platform and then you click on the for healthcare provider section of the page, you are provided with this section of the websites where you can onboard and get registered as a practitioner. For a medical specialist, you click on sign up. Okay, and here we go for the specialist onboarding process. This page is up. Then, as a specialist provider, when you're trying to get on board, you are required to provide your professional email address. When you drop your email address, you'll be sent a verification one-time password to verify that you're the owner of the email. So I'll try my email here and try to proceed with the verification for the medical practitioner onboarding here. Okay, so I need to enter my verification code there, the verification code that was sent to my email to get on to the onboarding process. So right about now, I'll just enter my verification code and then proceed with the onboarding process. Okay, so now as a specialist, then you are provided with the onboarding process whereby you have to like fill in the details that are provided with and then continue with the onboarding process. And then when you're done with the onboarding process, You have to wait till about 40 to 72 hours before your profile is verified by a medical board. In the next couple of hours, this platform will be live for users to test as our first MVP. Thank you very much.
Wow, thank you. Thank you so much, Miracle, for that. That was awesome. Thank you. I want to believe everyone had a great time with that presentation. So I want to really believe you had a great time with the presentation. If there is anything that you're not clear, please understand that we're here for you. So, but what we just why we put this up is to just help you navigate through the website easily, so you can get the best out of the website. All right, or out of the project. Um, so probably you have questions regarding some of the presentation from the CTO, that's Mr. Miracle. Please put it in the comment section. The team will reach out. We're going to be closing shortly. We promise you 1 hour, but because of the little glitches here and there, that's why it's extended. But very soon we're going to close. Just to summarize all that has been said, for now, we are onboarding for you just the specialists and the hospitals, all right? Meaning that we're bringing on board your doctors, your general practitioners, sorry, together with the specialists, and then the hospitals. Hospitals means that every hospital that you can think of, but we have our focus on Lagos for now. We're covering Lagos, we're covering Ibadan, we're covering Abuja, all right, and we're covering Port Harcourt. So these are the four main cities that we are bringing the doctors, the hospitals, and the general practitioner, the specialist, and then the hospitals on board. So these four areas are the main places where we're looking at. However, if you want just to come to your city, right, and then you have a doctor in mind that you want us to also that you want on the platform, please share the link. That's the website www.cliniconlineplus.com. Share it with them and they can get on board with that. All right. Now let me summarize and say this. If, for instance, you as a user, you come online and you need to search for anything, there is already a dashboard. See, it's just that line that is there for you. Whatever you're looking for, just put it there, boom, and click on search. It will do it for you. Actually, we have our the Dr. Case AI assistant, which we're going to be implementing, all right, in the next 4 to 6 weeks, based on how the user interaction is with the complaints and everything. That's what we're waiting for. All right. Immediately that is sorted out, we're going to implement it for you. Another second features that we're going to add for you as time goes on is you're going to be able to see your doctor just like when you're looking at Google Map, right? We're going to include that for you just beneath around the last page on the platform, so that you can see your doctor according to location. Oh, there's a doctor that is about 5 doctors that are close to me, and when you search, perfect. So like I said, you as the user just come, it's just 2 clicks. Come, put your symptoms, click it, you see your doctor, click on your doctor. When you click on your doctor, you see the doctor's profile. It asks you consult now. Like I said, we're not accepting consultation on the platform at the moment. So when you click on consult now, it can take you either to the doctor's WhatsApp number, or it's going to take you to the doctor's receptionist, and then you can book your consultation and you go and see the doctor. We don't have influence on the consultation fee, and we don't influence the cost of treatment. I need to clarify these two things. So that is why you as a user, when you're coming on our platform, you're not paying anything. All your payment goes to the doctor, or your payment goes to um, the hospital for now, right? For now, we don't have anything. That we just want to make sure that we don't want you to suffer again searching for doctors. And same with our doctors, we don't want them to go through the challenge of not seeing of not being seen, right? Yeah, we're dealing with visibility for doctors and hospitals. We don't want, that you can have a particular clinic seeing about 1,000 patients in a day, and then you have another hospital that is seeing probably just 5 in a day. Not because they don't have good doctors, not because the specialists are not capable, but because of visibility. And that's what we're trying to solve with these two people. So when you look at how the doctors, that's the specialist or the doctor, the hospital can get on board, the process for the specialists around step 1 to 5, and for hospitals about, I think, step 3 to 4 is quite shorter for hospitals. So you can get on board easily. It's not, but what we're trying to do while you have the step 1 to 5 is because we want to ensure that the doctor that we are bringing on board is safe for the users. One other thing I need you to understand is that you also have the privilege after 24 to 48 hours of consulting with your doctor. We're going to send you a follow-up message. Please, when you receive the follow-up message, click on it. And when you click on it, it will ask you to give us a review about your doctor. That's the doctor you've seen, your consultation. How was the experience? So you can rate the doctor for us. You can tell the doctor, tell us, comment about the doctor. What this does is that it will help any other user that is going to consult with the same doctor. So it will help them to know what to expect. Imagine you want to do um, IVF, right? And what you've always heard is from what people say. What if you can actually read the testimonies of people? Oh, about, so it tells you that okay, this is a 90% success rate this person have. This is 50% success rate. This is not just Google review, right? This is review from real patient that actually had, because you can't come online on our platform and put this in comments if you haven't actually get the what they call it, consulted with the doctor, because the follow-up email comes after you must have seen the doctor. So if you haven't seen the doctor, you can comment. You understand. So, and we keep getting better, we keep improving. But before we go, I have, like I said, I have three amazing people with us who are going to, maybe you have questions. That's why I said drop your questions. These are captains in their field. All right, these are doctors with years of experience under their cap. Actually, one of them is my teacher, right? He's someone that I respect so much, and that's Dr. Abidoi. So, team, please, I want to just confirm with you if we are set. I want you to bring them on board. Probably they have one or two things to just tell us, or they have questions that they would like to ask me and my co-founder. We are open to questions. So please, you can help me bring in Dr. Abidui and Dr. Noble. Best. Yes. So my chief is here. How are you, sir? You're
Yeah, hello.
welcome,
It's
boss.
nice speaking with everyone.
It's good to
How are
see
you
you.
doing?
Good to see you, sir. Thank you so much
Good,
for
good.
joining us. Thank you, sir. Don't mind
Yeah.
him. He's a very humble man. So please, but trust me, he has a wealth of wisdom. So he probably has questions for me. I'm here. All right. Or probably just want to just ask, say one or two, because he's our chairman, just for the sake of those who are listening. Yeah, he's our chairman. He's more or less the man behind that give us the guidance on one or two things to do. All right. So the floor is open for you, sir. I'm here with you.
All right. Thank you, everyone. It's a privilege and an honor to be part of the team with this novel platform. And the aim of this platform is to bridge the gap. As we all know, the health need and the unmet need of need in Nigeria and Africa at large. So I believe this platform is going to bridge that gap using the technology to help the system. So you've done justice, and Miracle too has always done justice. I also want to appreciate Jeremiah for the great work they've done. There are a lot of work to be done. There are a lot of obstacles to be crossed. But I believe with this wonderful team you have, I believe there's no limitation. For every challenge that comes in, I believe the teams are more than capable. You can see in the nearest future, this platform is going to be talked about, and everybody will love to play. Just watch out for the big one in the on the platform. Well done.
Wow, thank you, Chief. Thank you so much. Really appreciate that. That was so awesome. Thank you, boss. Thank you, sir. All right. So that's consultant, Dr. Femi. So I would like to find out, do we have Dr. Noble? Is Dr. Noble ready for us now? That oh beautiful. See how God does. Yes. See the man himself. This man here. Hey, you see, I told you guys I've got big men for you here. Very all of them very humble, very, very humble doctors that they are doing powerful things, powerful things. So, doctor, is I'm so pleased to have you here. Thank you so much, sir. Thank you for joining us. So, the floor is open for you. Don't let me do too much talking.
Um, Good evening, good morning, wherever you're watching from. First of all, I'm humbled actually to be amongst beautiful minds and great innovators like I said, I'm humbled to be here. I can also see my leader, Dr. Abidoye. It's also a pleasure to also see you, sir, and all the other guest speakers. Like I said, I'm truly humbled to be here, and it's great work you guys are doing. Honestly, when I was invited to speak at this launch, one of the first things that came to my mind was how easy is it for someone today to actually find the right doctor? Just think about it. You need a cardiologist, your child needs a pediatrician, you need a dermatologist, or you suspect that you may have been exposed to infections like hepatitis B, HIV, STIs, or perhaps simply you just need a doctor who understands a particular condition. What most people do is that they check through their contact list. Do I know someone here? Do I know somebody related to someone here? So, but creating that digital bridge, I think that has been a major challenge in the healthcare landscape. And having a platform like this that can bridge that gap, more like an Uber system, if I should borrow that word, that could connect healthcare workers to end users, connect hospitals to patients. And because you can have the ironic thing is that you can have 10 years experience, 20 years experience, you are an expert in your field. But if there's no visibility, it just defeats the aim. You understand? You can have expertise and no accessibility. So I must commend the team that thought of this, and I'm happy that this platform exists. And thank you for having me once again.
Well, thank you. Thank you so much, Dr. Noble. Thank you. I see why we needed you here. I mean, thank you. Thank you. That was so great. Thank you so much. And it's a pity that we couldn't have Queen Nuts here to just say one or two things as well. But I mean, we've had an amazing time from Mr. Jeremiah, myself, the CTO and co-founder, Mr. Miracle, Dr. Femi, Dr. Noble. Thank you so much, everyone. And then back to the users. I mean, thank you, everyone, for joining the platform tonight. And also to my team, I love you all so much. Thank you. Thank you for the great work that you put together to be able to have this launch. I really celebrate you all. Mr. Jeremiah, I'm doing your job. Oh. Apologies. Are you ready? Is Mr. Jeremiah there? All right.
Yes,
Please, you can drop me.
I'm
Thank you,
fully
my Oga.
ready.
Well done,
All
sir.
right. Thank you so much, everyone, for tuning in for this pre-launch of Clinic Online Plus. So you can head to the website at www.cliniconlineplus.com. The plus is not the normal sign. The plus is being spelled plus.com. So you can check us on Twitter. We are live on Twitter at C underscore online plus. Also, we are on Facebook, Clinic Online Plus. or you can follow Dr. Case on Twitter. You can follow Dr. Case on Instagram, Clinic Online Plus on Instagram, TikTok, or the social media platform. And to everyone who tuned in once again, we say thank you. Clinic Online Plus says thank you so much for being part of the pre-launch. And to our community on the WhatsApp channel, we also say thank you so much for always sticking around, for always interacting, for always sharing the contents that is being posted on the WhatsApp channel. To our guests who tune in, Dr. Nobu, Dr. Ebenezer Abidoyi, we say thank you for your wonderful words, your encouragement, and your insights about Clinic Online Plus. And to the team, to Precious, to Fields, to Dami, and also the CTO, Miracle Oladapo, and to our very own CEO, Dr. Case. We say thank you. Thank you for being part. Thank you for bringing this healthcare platform to Africans, to explore and get a better health. Together, we can build a greater Africa where everyone thrives in all sectors, especially the health sector. In families, your children, your husband, your wife, your friends, just introduce them to www.cliniconlineplus.com. Thank you so much and God bless you all. For me, it's good night and bye bye.